Hello everyone, and a very warm welcome to all of our dear friends joining us on the channel today. We are truly pleased to have a special patient here with us, and her name is Anastasia. It is a very nice pleasure to meet you, and we hope it is probably a wonderful experience for you as well. Tell us what brought you here. How did you get here?
It's wonderful here, such beautiful views, a little river, nature is waking up, it's just gorgeous, simply a pleasure to walk around.
After the procedures, you'll be able to walk around?
All right. So I teach vocal lessons to little kids at a children's school, and I spend quite a lot of time sitting. And in general, I really like sitting at the computer a lot. I think that's a problem for many people these days. I also go to the gym and do dance classes. My dance classes are on the pole, it's all pretty tough. There's a load on all the muscles, the vertebrae and so on. And sometimes, my back bothers me a little after dancing. And that's it.
All right. Okay, now let's get to the point. Have you had any injuries? No need to think too hard about it.
No, I haven't had any of those kinds of injuries.
No, I've had no injuries like that.
All right.
Twisted it?
Well, yeah, I twisted it when I was going to Gypsy. Does that count?
So did you have a splint then?
Well, it was something with my muscles. I don't really remember. It was a long time ago.
Something was wrong somewhere there.
I wore that cast forever.
All right. And when did you take it off? Well, most likely a sprain.
Likely a sprain?
The muscles. Did they specifically put one of those heavy boot-like medical splints on you?
Yes.
How long did you wear it?
It was a long time ago, but quite a while.
How long ago was that?
How old was I then? Maybe 13 or 14 years old.
So you were playing outside?
Yes, I was playing. I accidentally twisted it.
All right, okay. I'll just check how old you were.
Okay. Nothing else like that happened. Seriously.
After they took off your splint, did you have physiotherapy or therapeutic exercise?
There was something like that. I had to learn to step on it again.
And how did it go?
Well, I can walk now, can't I? So I learned.
Good. Do you feel any discomfort after running on the treadmill?
No.
Not in your spine? Not in your leg? Nowhere?
No.
No discomfort? Good. Any surgeries?
I had blepharoplasty.
And everything else is factory original?
It's all factory stock.
All right. So, any chronic illnesses?
Well, I don't think so, as far as I know.
Okay. Eyesight, blood pressure, and...
To be honest, my eyesight has never been particularly good. So a few years ago, I decided to have corrective laser eye surgery on both of my eyes. That's also it, that's all. And
how bad was it?
It was about -4. It's about the same here.
Did they diagnose you with astigmatism?
I don't remember exactly. If there was anything, it was something very minor.
All right, good. You had the correction done. What's your vision now?
I haven't checked, but basically it doesn't interfere with my life. My vision has dropped a little because naturally I'm always on my phone and laptop. But, I don't know. I haven't checked because I don't really need to right now. I had the procedure done in another city, so it's not easy to just go back and forth.
I see. Did you used to wear glasses or contacts?
I wore glasses. I don't know how to use contacts. Wearing them just isn't for me at all. Glasses annoyed me. That's why I went through with it.
A picky patient. All right, fine. Let me remind those who aren't aware, since the eye muscles are affected, there are also therapeutic exercises for the eyes. Did anyone tell you about them?
Yes, especially when you first get laser surgery, because you have to do them every day so that everything settles properly. I did it, then less and less over time.
And less. We're talking about the eyes here?
Well, you also have to keep doing it for quite a long while after the surgery is finished.
Well, that is just how it goes.
To exercise the muscle.
Yeah, so basically, that's it. And of course I did it, but not very often.
What do you remember?
I think you had to look at one spot or something like that. I think you had to close one eye, then the other. And for a certain amount of time, I don't know, like a minute. And you keep doing that to focus.
Your gaze. Yeah, that's one of the exercises. You close one eye. You can do it with both eyes, but here the point is to concentrate on one eye. You have to pick an object. Both objects, they should be one behind the other, but at different distances. So you focus on one object, and then you switch to the one that's farther away. That is without changing the angle or anything like that. You just focus on the other one. The muscles engage, and the focus shifts. It's the same as on a phone, only so to speak, upgraded to 16K quality. And I don't know, maybe even 17,000D. Well, because we all feel it. TVs just don't give us that yet. That effect anyway. Although who knows, as they say. We used to laugh at drones too, but in the end, now we're watching them. Alright, fine. So, is there anything else to tell? Will you sing?
No, I'm sorry, I will not be singing at all today. All right then, maybe next time.
I thought we were about to listen now. And after the procedures?
I don't know.
Alright, agreed, fine. Basically, that's all. I also asked something in parallel that I hadn't asked during the video recording. So that's about it. Do you have any questions for us? No. Then let's move on to the laser diagnostics. Don't switch channels, be sure to watch until the end and subscribe to the channel. Right? Alright, enough talking, let's move on to the diagnostics. So, dear viewers, we are ready to proceed with our diagnostics. Let's measure your height. What's your height?
170.
Are you sure?
Well, I think so.
Alright, let's check now. We'll also do a laser diagnostic. We'll check for symmetry and asymmetry. We will conduct tests. Shall we do it?
That is correct.
We'll do it. Here, this will be before and of course also after the manipulation. Let's look at the dynamics. We will also measure the height. Growth generally becomes taller. Today the patient once again proved to us that he is a patient. Meter. 95 was, no, Dimitra was 97 centimeters, and then she became 1 meter, 99. And with some millimeters, I don't remember exactly anymore. In general, that's how it is. If you want to watch the full video, you can follow the QR code. We're ready to begin. Nastya, are you ready? Operator, are you ready? Is everyone ready? So it turns out I'm the only one not ready, right? Alright, I'm always ready. Relax. We're pulling the pelvis back, the pelvis stretches downward, and the ribs, where am I pulling them? Everything is fine here, but what about here? So as you might naturally expect, now absolutely every single thing will be completely the polar opposite for us. I wonder what exactly is going on here. So, are you actually telling me that you don't want me to talk anymore? I'm just making sure I understand. Alright, the lower back moves very well here, so I'm stretching it. I feel that everything is moving quite well. Breathe. Inhale, exhale. More. Relax. Good. All right then, let's let it go. Will you let go? No, you're holding on to something. Let go. Yes, that looks really good to me. It is on the other side. Let go. Relax. Well done. Actually, to be honest, everything is going quite well. I praised you. Your task now is to turn onto your side. To the right. Bend your arm under your head. Like this. Lay it down and move closer to me. You got burned. What? Ah, I see. Turn over. Other side. Yes, move closer to me. Like that. You grew. Sit up.
Facing that way?
Facing that way. Towards the audience. It's already been, I don't know, 5 years and still 5 or 6. I just can't with this couch anymore. It's always either up or down. Okay, hands locked behind your head. Look wherever you want. Just make sure to tilt your head down. Relax. Butt down.
Yes, butt down.
Wait a moment. Like this and like this. Good. Well done. This part needs to be cut out. Or maybe not. Anyway, alright, sorry about that. It's all because of the magnet. That's why it turned out this way. Alright, now we are moving on to the neck area, the cervical section. So let's get ourselves ready for the next part. Are you ready? Relax. Tilt. Well, let's move on to another part. Tilt, relax. Alright then, if you could please subscribe, that would be really good. Now, why don't you go ahead and hand over the microphone to me? Still, something's not right. Lie on your stomach. The lateral muscles of the cervical spine, arms along the body. Put it here, all set there. Rest your chin on your hand.
Like this?
Yes. We gently tilt the head back and slowly stretch it out. The neck muscles, and more. What happened?
A crack.
A crack. Well then, let's move on to decompression. Turn over. Answer us this. Do you know what decompression is? You have no idea at all? And compression?
To be honest with you, I really don't know the answer.
Well, that's fine. So, on this wonderful note, let's move on to decompression. Our viewers, well, some might guess, some don't know. Some already know what the neighbors are doing. From time to time. Well, maybe for their wife, maybe for a friend, I don't know, yeah, maybe. So, well, I'll explain. Still, manipulation is important. We fix the jaw in the occipital bone using the traction method and stretch the spine. It's safe, it's not painful, which we'll demonstrate today with Anastasia. Yes?
That is correct. Indeed it is.
Well, we're getting ready for decompression. Well, we are ready to perform spinal decompression, traction, stretching. That's another name for it. That's another way it's interpreted. So, have we explained everything to the patient? Well, judge for yourself, you can see she didn't understand anything. Anyway, we're ready. She said goodbye, smiled. and God be with us. The task is to relax. All right? All right?
Yeah.
Okay, I'm turning. You ready? Don't turn your head. Just don't turn your head. Now try to relax and don't attempt to control it. Wait a second. Here you go. Take this on the pillow. Now please slowly stand up for a moment. That's it. Now just lie back down, get comfortable, and try your best to fully relax. Think about ice cream. About...
Delicious ice cream.
No, well, ice cream is associated with summer, ice cream... I don't know, yeah. Alright, dear viewers, let's move on. We've done the decompression, so how was it for you?
It was fine.
Not bad, right? I see this every day. Alright, let's move on to the lower limb. Let me remind you, this person here dances and sings, that's just how it is. Let's take a look at the hip joints. You need to relax your leg.
Relax it, right? Yes.
It's important for us to be able to see the leg from here. You can see that the leg is relaxed, right? The leg is relaxed.
Well, I think so, yeah.
Relax it again. Don't tense up. You'll tense up. Well, it looks like there's a blockage here. And now, come back. Right now, I am going to attempt to transmit the audio signal through the microphone, specifically at the moment when the blockage is finally released. Relax. Maybe you heard it. I'm not sure, of course, but these microphones are quite sensitive. And now you'll tell me what has changed in the hip joint. If, of course, you relax.
Well, I think I'm relaxed.
Yeah. What did you feel?
I can't describe it. Yeah, that's clearer.
Basically, the hip joint is being pulled, meaning it moves freely. I'm moving a bit higher now. Right. Yes, just with the other leg. Relax, relax. For some reason, they are totally blocked. Okay, relax. Yes, and the microphone. Let's try again, so to speak, to transmit the sound. Relax. Actually, everything is fine here. It's just that when the patient doesn't relax, it feels like something is blocked. Relax. What did you feel?
I definitely felt it right here. Just now, very clearly.
Like a crunch. Yeah. It's stretched out. So that's possible. Look, we have a crunch here. Basically, it's joint mobilization, the capsule popped, and that's it. And here, what was it? The same thing.
It is exactly the same.
More?
Oh, yes.
Come back. Well, I'm demonstrating this so you understand that it's not a crunch, it's just the joint moving. And that's normal. Relax. Good job. Turn onto your stomach. Get up on your elbows. Yes, right on your elbows. These aren't elbows. Where are your elbows? Like this. Bring your elbows together. A different towel. The one that fell I put away, just so you know. Elbows together, and let's do a stretch. More. Yes, come on now. Good job. All right, sit up.
My face.
Face the audience. All right, now we're going to move on to the control test. For those who want to watch the full video, we can't post it on our YouTube channel due to the rules. And for those who want to watch the full video, you had a QR code, right? Yes, here's the QR code. You can get it from Anastasia. I can give you a hint. You can also click on the video and follow the link. Let's move on to the control tests. Well, dear viewers, we've come to the end. Anastasia, a few kind words, so to speak. What did you like? What didn't you like?
I've gotten taller a little bit. Well, more like, in short, the tension I had, especially around my shoulder blades, is gone now. That's wonderful. What I liked most was when they worked on the legs.
You mean during the stretching?
Yes, during the stretching. And the last part, when they worked on this area, that was just top-notch, at least for me.
With the other one, everything hurt more for me.
Oh, and the radial one was great because at first it hurts a lot.
The wave therapy.
Pardon. At first it hurts a lot, but then suddenly the pain just goes away. And then it moves on to the next area as needed.
Yes, as I've said many times, we find the trigger point and then break it up. So the pain rises to a peak and then starts to subside. That's really how it is. I've gone through all of this myself, of course. What didn't you like besides the operators?
No, Tomczyk. No, well, the process itself, of course, when there are painful sensations, that's definitely unpleasant. And especially when you hear those cracks, it's actually a bit scary.
But it doesn't hurt.
But it doesn't hurt, no. It's just, well, there's definitely some fear, like, damn, now they're going to press and that's it.
And that's it. And,
You'll just black out.
well, you're officially upgraded for today. Good job. Actually, we even had a laugh. We laughed a lot. It's a pity not everything will make it into the video. But we'll try to include something. Dear editor.
The most important thing to consider is
the kitty. Without the cat, it just won't be a video. Thank you so much for watching the video all the way to the end. Share the video, pass it on to others, to your neighbors, friends, brothers. Let your sister watch it and your girlfriends too. Basically, leave comments, what's wrong, what's right, what you liked, what you didn't like. So that's about it. You did great, you became symmetrical, you got taller. So, fly, Liza, as they say. That's it, thank you all so much. We, so to speak, lifted you up. Well, I lifted you up, I can't be lifted. I lifted you up, hugged you, put you down, kissed you, and let you go. That's all. See you next time. Bye everyone, bye.